there's a secret going around East Texas and abroad that no one wants you to know. That individual that you're going to get filler and Botox injected into your face with needles went to a 2-day course, and maybe an eyelash girl, and maybe an esthetician, maybe someone that is doing this as a side hustle. They are not qualified. If this individual cannot produce a medical professional license of some sort, whether that be a nurse practitioner license, physician assistant, medical physician, or a registered nurse, they should not have a syringe and needle in their hand. Do you feel confident that if you truly knew their certification was a 2-day course, that that individual would know what to do if they injected filler in your face and immediately an artery was occluded? Meaning circulation of blood is not reaching your face anymore. Time is of the essence. If that happens, that filler has to be reversed, and some can't be reversed. And so you cause permanent necrosis, death of tissue on the face, infection, deformities, if that is not reversed in a timely manner. It's very scary. It's very scary to see the amount of individuals that are confident enough and are brave enough to be doing things outside of their scope of what they were trained to do. Like, I could go to CPR course, but that does not make me a cardiologist. I could be a certified toilet cleaner. Doesn't make me a plumber. The whole point of this is that just because there's a certified injector certification hanging on the wall, if they are putting needles near your face, you need to make sure that they are licensed by some certifying body. The Board of Nursing, Texas Medical Board. Those are the two. You need to ask a few questions. Where did you get your medical training? Who's your medical director? Who is the provider that is overseeing these services that you're providing? Where did you get your training? How long have you been doing this? So you have to be able to write prescriptions in the state of Texas to be able to order these types of medications. So it makes me wonder, where are they getting this tox? Where are they getting this filler? It's either counterfeit, it's coming overseas, it's expired, or there's a provider selling to them in the back door because they're wanting to get their money back from it. Something. Just because they say that they're certified does not protect you, and it does not protect the individual that decided to take this task on. If something goes wrong and there's no medical license, there's no prescriber, and no malpractice coverage, you have no protection. And this isn't gatekeeping, this is patient safety. So, only licensed medical professionals operating within the state of Texas should be licensed to inject. Certified. Another thing is IV therapy. I'm seeing that a lot. And this isn't something that just anybody should be offering in their little spa that they opened up. There was a law that was passed September 1st of 2025 that is called Jennifer's Law. Jennifer's Law was created because Jennifer was an individual that went into a spa to get IV therapy, and she did not receive a medical evaluation, medical history, an assessment of her body. There was no physician in-house. There was no physician within miles. There was, this ultimately resulted in her death because individuals are mixing things together and putting them in IV bags and then putting them through patients' bodies. And this individual died. It's a mom of multiple children, and thought she was going in for IV hydration and lost her life. So, under Jennifer's Law, IV therapy is considered a medical treatment. And the patient needs medical evaluation. It needs a licensed provider involved. There can't be any standing orders, meaning like a physician said, I allow this person to inject XYZ or infuse XYZ when I'm not here. That is no longer allowed. The clinic must be specific to safety and delegation oversight. If there's no physician, there's no medical provider, and there's no patient assessment that occurs, walk away. This is not compliant within Texas state law if you are not any of those 3 individuals with medical licenses that I mentioned. So infections, your electrolytes can be off. It can, with a cardiac history, it can overload your heart, put you into cardiac arrest. There can be tissue injury if the individual doesn't know how to watch the site where the IV is infusing. There can be permanent harm where you can't use certain parts of your limbs. So I'm just saying these things because I've seen them go on, and as this industry has grown and there's more popularity around med spas and wellness centers, there are a lot in our immediate area, and I can spot them out a mile away, that they're doing these things without medical supervision. So with that said, make sure you're asking who their medical director is, where do you get your supplies, and where did you get your medical training. If they can't answer those things and they can only show you a certificate on the wall, you might want to walk out. But anyways, if you have a question about it, or if you're not quite sure, should I be going to this individual, you could always, shoot me a message and I'll let you know, hey, looks kind of sketch. Someone reached out to me recently and said, I know that you're qualified and you do this, injecting and stuff, but my friend does Botox and filler in XYZ town, very close. And she's selling filler and Botox bundled together for $300 something. I'm like, first of all, that's not even what we pay for that stuff. Second of all, who's selling it to her? Where's she getting it? And third of all, it didn't take a rocket scientist if this individual didn't have an address on their public pages, social media, would not disclose where they're doing these things, but publishes that they are a certified injector. Post lips, I see the lips. Some, by the grace of God, have turned out well. There are multiple photos I look at and I can point out every little flaw in them and how it just looks ridiculous. So, if you want to come and get some real, treatment, some real filler from a real medical professional, from someone with real experience, come to Lone Star Wellness Clinic or any other clinic that is staffed with medical professionals. All right, thanks guys.